Hello, David Nassine. This is a little tutorial on the midline brain anatomy. First thing I think that you should take note of is that this is a T2 weighted image. CSF is quite bright and the white matter is quite dark, especially the corpus callosum there in the middle of the screen. You'll see a lot of dark signal in the blood vessels, both in the arteries and the veins, that we'll talk about later. The first thing I'd like to talk about is the third ventricle that you'll see outlined here in blue. If you want to think of it this way, fluid enters the third ventricle from above in the region of the foramina of Monroe and then leaves posteriorly through the cerebral aqueduct. The cerebral aqueduct, also known as the aqueduct of Sylvius, is a channel through the posterior aspect of the midbrain that connects the posterior aspect of the third ventricle to the fourth ventricle. The exit foramen that you can see on the midline sagittal image is through the inferior aspect of the fourth ventricle, called the foramen of Magendie, or Magendie if you're an American, and the lateral outlets that you cannot see on the midline sagittal image are the foramina of Luschka. Alright, let's go back to the third ventricle, and if you use your imagination, you can think of the anterior aspect of the third ventricle as a W that you'll see here outlined in green. The structures that make up the W, starting from the upper left, are the anterior commissure, which is a white matter tract that connects the two temporal lobes together and is involved in olfaction. A thin band of white matter called the lamina terminalis that connects the anterior commissure to the optic chiasm, which is somewhat oval-shaped. This leads to a little reflection, and the first of the anterior recesses of the third ventricle, called the chiasmatic recess. The second recess is called the infundibular recess. Infundibulum is Latin for funnel. The fibers coming down from the hypothalamus into the pituitary stalk form this funnel as they head towards the neurohypophysis. Across the floor of the third ventricle is the tuber cinereum, which is Latin for ash-colored potato, two paired structures of the hypothalamus, and these connect to the posterior part of the W, which are the mammillary bodies, two paired structures of the hypothalamus. So the next structure we'll talk about is the midbrain, or mesencephalon, conveniently located in the middle of the brain, outlined here in green. The main structures I want you to identify are the most dorsal part, called the midbrain tectum, that is Latin for roof. It's the quadrigeminal plate, so called because it has four brothers, the superior and inferior colliculi, the paired little bumps on this structure, also called the tectal plate. The floor of the midbrain, if you will, is referred to as the tegmentum. Tegmentum is Latin for covering, not for floor actually, but you can think about it as the floor. Next part we'll talk about is the pons that connects the midbrain to the medulla, and the ventral portion of the pons is referred to as the belly, the bulbous portion that points anteriorly, and the dorsal portion or posterior portion basically runs up against the fourth ventricle. The bottom of the brainstem is called the medulla, or the medulla oblongata if you're a fan of Adam Sandler movies. The most interesting thing, anatomically speaking, on the midline sagittal image is along the posterior aspect of the medulla, where there's a little shelf-like outcropping that represents the obex, and the obex is the site where the central canal of the spinal cord originates. You can see it faintly outlined here with arrows as it extends through the lower end of the medulla into the cervical spinal cord region. Next we have the Cerebellar Vermus. Somebody must have thought that it looked like a worm because that's what vermis means in Latin. Basically, you could think about it as being divided into two separate but unequal parts, the anterior lobe, which is superior, and the posterior lobe, which is basically inferior. But if you remember that these structures were named based on the neuroanatomy of quadrupeds, it makes a little bit more sense. The demarcation point between the anterior and posterior lobes is the primary fissure that I have outlined here. The cerebellar vermis is useful in maintaining posture, and its absence is associated with the Dandy-Walker malformation. Another anatomical point in this region is the Vestigial Point of the fourth ventricle, which is the triangular posterior portion of the fourth ventricle. And another interesting anatomical feature is that the vestigial point should be pretty much in the middle of the belly of the pons. If the vestigial point is located too high, that's usually associated with a molar tooth abnormality, the Joubert syndrome. The largest of the commissures is the corpus callosum. The commissures are white matter structures that connect across the two cerebral hemispheres. Subdivisions of the corpus callosum are the rostrum, or beak, the genu, which is Latin for bend, the body, and the splenium, which is somehow derives from the Greek word for bandage. The distinction between these different points is made by some anatomical features. There's really no good feature that I know of that distinguishes the pointy rostrum from the genu, but the genu is divided from the body by the line that connects vertically through the mammillary body and the anterior commissure, and it continues through the corpus callosum. And then the demarcation point between the posterior body and the splenium is through the narrow portion, or isthmus, of the corpus callosum, noted here with an arrow. So the three main commissures are the corpus callosum, the anterior commissure, and the posterior commissure, which is here outlined in green. The next structure we'll talk about is the fornix, which is a white matter structure, Latin for arch, which is part of the limbic system and connects the hippocampus to the mammillary bodies. It's very important in formation of memories. Next structure that doesn't really fit into any other good categories is the pineal gland, named because it resembles a pine cone. The pineal gland regulates circadian rhythms and secretes melatonin. It's located just posterior to the posterior commissure and adjacent to the superior colliculi, and along the backside are the internal cerebral veins and the splenium of the corpus callosum. It's a fairly common site to develop a cyst that, when large, can compress on the superior aspect of the tectal plate and give you something called Paranod syndrome. It's a paralysis of upward gaze. Some vascular anatomy that you can see on the midline sagittal image includes the superior sagittal sinus, which is the big vein across the top of the head that extends posteriorly to the region of the torcula, which is also known as the torcular hierophyly, or winepress of Hierophilus, or the confluence of sinuses. Also on the midline image we can see the straight sinus, which also drains to the torcula. Just adjacent to that, and just inferior to the splenium of the corpus callosum, is the vein of Galen, and then what is draining into that are these paired internal cerebral veins. On the arterial side we see branches of the anterior cerebral artery, specifically the A2 branches just beyond the anterior communicating artery. When it swings back posterior over the corpus callosum, that is referred to as the A3 branches, the main branch of which is the pericallosal artery. Most people have a callosal marginal artery that runs a little bit higher in the cingulate sulcus, but this patient doesn't have one. Okay, we're switching gears for a second to the midline sagittal T1 weighted image, where gray matter is gray and white matter is white. We call that anatomic gray-white differentiation, which is the opposite of a T2 weighted image. Again, you'll notice that the CSF signal intensity is quite dark, and I would draw your attention to the posterior pituitary gland, or the neurohypophysis, which is quite bright on a T1 weighted image. Sometimes you'll have to struggle a little bit to distinguish the bone marrow signal of the dorsum sella from the posterior pituitary gland, but this one is pretty clearly the neurohypophysis. The adenohypophysis has, at least on T1 weighted images, signal intensity similar to that of gray matter. Some skull-based anatomy that's important to be aware of. The foramen magnum, which is Latin for big hole, is at the bottom of the skull, and the anterior border of which is called the basion, and the posterior border of which is called the opistheon. The posterior portion of the sphenoid bone is called the clivus, which is Latin for slope. And also evident on this patient's image is a 11-year-old kid is the sphenooccipital synchondrosis. This kid also doesn't have much of a sphenoid sinus at this point. You can see a little rudimentary sinus, but in many patients the sphenoid sinus will extend all the way posteriorly underneath the sella turcica, which is here outlined in arrows. The flat portion of the sphenoid bone anterior to the sella turcica is called the planum sphenoidale. Anterior to that, just behind the nose, still in the intracranial compartment at the midline of the anterior cranial fossa, is the crista galli, or rooster's crest. And that's it for my version of the midline brain anatomy. Thanks for paying attention.